Hi everyone, it's Claire Jarvis here from Restore Fitness Therapies, and in this video I want to talk to you about upper back pain experienced during pregnancy and that immediate postnatal period. Now when we're talking about the upper back, we're really talking about the base of your shoulder blades up towards the base of your skull here, and the affected muscles are your rhomboid muscles, and these are the muscles which hold your shoulder blades in towards your spine, and also your trapezius muscles, and there are two of them. You have one on the left side of your spine, one on the right. They're completely symmetrical and they run from the base of the skull and out to the end of your shoulder and then back into your spine again. So it makes a kind of long triangle of muscle, and you've got one on either side of your spine there. Now the reason people end up with this upper back pain is because of a little bit of dysfunction in their posture. What's basically happening is you starting to lean forwards, and what happens when you lean forwards is that those rhomboids get stretched and weakened outwards, and those trapezius muscles get stretched and weakened as well. Now what happens if you have a long weak muscle and you then try to use that muscle to pick something heavy up or to do anything with that muscle is it can't cope with the weight, and you end up causing strain, injury and pain. So that's what's happening there. Now what happens as well when you start leaning forwards is the shoulders tend to hunch forwards as well. So you might sort of recognize this posture. It's relatively common these days because we spend maybe more time sitting at desks, sitting at very small devices, sort of looking forwards in this position here. Now what also happens is once you start hunching and leaning, you're then forced to lift up your chin so you can see what's happening ahead of you. So now you've basically shortened all the muscles in the back of your neck, and you're creating this tension through the back of your neck, which can cause you pain in your neck, but it can also refer up into your head and cause headaches as well. So if any of those symptoms sound familiar to you, that's basically what is happening in your back and what muscles are being affected and how. Now, a lot of women experience this upper back pain during pregnancy and postnatally, and a bit like when we were discussing lower back pain in the last video, a lot of people assume it's just an inevitable part of being pregnant and being a new mum, but it absolutely isn't. It really is completely avoidable, and if you are already struggling with it, it is completely possible to eliminate this upper back pain as well. Now we are more vulnerable to upper back pain during pregnancy. As we discussed before, we're getting bigger through the front of the body during pregnancy, during that second and third trimester. Our breasts are increasing in size and in weight, and that is going to start pulling us forwards and causing us to hunch because of this additional weight through the front of the body. So that's how we can end up in this slightly forward bending position. And then postnatally, similarly, our breasts are still larger and heavier than normal as we're producing milk, so we're still in that danger zone of being pulled forward. What can also happen in new motherhood is if you are, whether you're breastfeeding or bottle feeding, you're now probably finding yourself more in this maybe slight hunched position if you haven't quite figured out a comfortable position to be in yet. You might be finding that you're sleeping a little bit awkwardly if you're co-sleeping, for example, and you're also lifting and carrying heavy things. And because we've lost a lot of that core strength in the early postnatal days, we might find ourselves relying a lot more on our back muscles, and we might end up starting to lean. So upper back pain is very common. It's very, or we should just say we're very susceptible to it during pregnancy and postnatally, but it's certainly not something we need to accept as a standard given in that part of our life. Now there are a couple of things that we can do here. There's two different things I want to talk to you about. One is strengthening and one is stretching. So we talked about how our rhomboid and trapezius muscles have been weakened and lengthened. So we need to strengthen those muscles. We need to think about exercises which are going to pull us back into position here. Now some of the favourites that we do with our pregnant and postnatal clients are our seated row exercise, which is fantastic here, and lots of exercises that encourage us to open up the chest. So what it also does is help you to stretch out your pec muscles, which we'll get to in a moment. So we're going to strengthen those trapezius and rhomboid muscles by doing lots of those lovely exercises that open up the body, like our rowing here. And then what we also want to do is to help us to stretch out muscles as well. So we want to stretch out these pectoral muscles because they will have been shortened by this hunching process. So things like our lovely doorway stretch, or squeezing the elbows together with the hands in the lower back. There are loads and loads of stretches that we can do to help us us open up the chest here. And we also want to be stretching out the back of the neck where we might have started poking our chin forward and lengthening here. So something as simple as chin dips as well, holding the chin down, taking those shoulders back and down, and just allowing yourself to feel that stretch through the back of the neck and down into the middle of the back into those trapezius muscles is really, really valuable. So it's basically a combination of strengthening those long weakened muscles in the back and then stretching out the muscles at the front of the body and also in the neck there. So I hope that shows you that upper back pain is certainly not an inevitable part of pregnancy and new motherhood. It is absolutely avoidable. If you want to join us for classes, we can take you through those exercises, through those stretches, show you exactly what to do. We have tons of free content on our YouTube channel as well there, but I want you to know that it's not something that you need to put up with. If you do want some help from us, as always, please do get in touch. We're very happy to talk through what it is that you're experiencing right now and make sure we can point you in the right direction. We've got self-guided courses online as well as live courses, private classes, all sorts of things. So I know that there'll be something out there that suits your current situation. So I hope that has helped you today. I hope it's put your mind at rest. And like I say, do get in touch with us if there's anything we can help you with.